Hello, and welcome to Care Conversations. This is episode 5. My name's Jesse. I'm the communications manager here at Sioux Lookout Health Center, and I'm your host. Each episode, I'll be taking you behind the scenes of what goes on here at SLMHC. I'll be joined by Leena Thibodeau, who manages our laboratory department. We'll be talking to Leena about the services we offer out of our lab, and we'll also be talking to her about the critical role our lab plays in supporting timely and accurate diagnoses for patients. We're excited to be joined by Leena Thibodeau, our laboratory manager here at SLMHC. Leena, thanks for joining us for this episode. We appreciate your time. I know a lot of people would just quickly associate our lab with needing some quick blood work done, but we actually offer a lot of extensive services out of our lab. So just wanted to start off the top, just what do those services consist of?
Yeah, we do offer quite a few services here in Sioux that, you don't have to travel long distances to obtain. So we have hematology, which offers blood cell counts to help diagnose different types of blood disorders. We also offer chemistry, which will help physicians identify whether patients are in liver, kidney failure, or many other disorders like diabetes. We offer transfusion services where we will do your blood typing, blood preparation to give you blood transfusion or plasma, molecular testing for which is like a genetic PCR-based diagnostics. This was the main platform for testing COVID-19 when it first came out. We also offer microbiology services where we culture and identify different bacteria that might be causing you an infection. We perform susceptibility testing on those bacteria to offer the physician the right antibiotic to treat the patient.
No, that's perfect. And I know there is instances where people do have to travel for other types of services, but how important is it that we do offer that extensive list right here in Sioux Lookout?
Yeah, it's very important because for us and our patients, we know traveling to a large center is timely, costly, and honestly causes a lot more stress for patients. So offering these services right here in Sioux Lookout allows, for quicker diagnosis, a lot less stress for patients, and we can really start treating patients that have critical illnesses right here in-house.
And earlier you had briefly mentioned COVID. I know during the COVID-19 pandemic, obviously the lab had to really narrow down and have some just key priorities. But since COVID-19, I know you've been able to kind of shift those priorities around, be able to expand a little bit more. So what has that growth been like since coming out of the pandemic?
Yeah, the growth has been forward and great, that to the point where we've really stabilized testing services and what we've been able to offer in bringing on new tests to support our community and what physicians or patients may want or need within not having to travel distances. But we've also been able to break through a bridge where we have an HHR crisis when it comes to lab technologists, which are the staff members that would be releasing the results to the physician. So we've developed an onboarding program within our hospital called Advanced Laboratory Technicians, where we grow our own homegrown talent. We take lab technicians that we currently have here and we build them into a scope of technologist role. So it's been really good to be able to take homegrown people and keep them here and allow them to help us grow further into the future for our lab.
And I know like our lab department and our lab team, I guess they would be kind of considered unsung heroes just because not a lot of people see what they do every day. And I know kind of on a day-to-day basis, they might have to adjust and adapt to, whatever the needs are that day. So as the manager, just what's it been like to see your team's ability to just adjust to that ever-changing landscape in the lab on a daily basis?
Yeah. Well, I've been in this position for almost 3 years now, and I have to say it's been extraordinarily humbling to see how quickly everybody can adapt to the forever changing demands that happened not only week to week, but day to day, hour to hour. When it comes, a critical patient comes in, we drop everything and we do what we need to do to get everything done and treat the patient. But on top of that, everybody's just been really open and willing to learn more, do cross training, take on new responsibilities to not only help promote our laboratory, but to help the patients and to show that we do care and that we do want to provide excellent services.
No, that's perfect. And it just sounds like we have a really great team in our lab who are working hard every day at all hours of the day just to make sure our patients' needs are met. So we appreciate your time today, Leena, and thank you for joining us.
Yeah, thank you very much. I appreciate being here.
Miigwech, thank you for tuning into this episode of the Care Conversations podcast. If you've missed an episode or want to rewatch a previous episode, all of them are available on our YouTube channel at Meno. To stay up to date on all things Sioux Lookout Meno Health Center, follow us on social media with the same handle at Meno. We look forward to bringing you more episodes. Until next time, stay safe and take care.